Hello and welcome to Transitions to Parenting Tips and Tricks. This week we're going to be covering bringing baby home. So on the agenda today we go from at the hospital and some of the things that your baby's going to have before you even leave the hospital, and we'll move on to about your baby, and this will cover anything from their feet, hands to the top of their head. So we're going to get going here.
Okay, the first slide that we're going to look at is what they'll do at the hospital before you leave with your baby. So, eye drops. The Canadian Pediatric Society recommends that all newborns receive antibiotic eye treatment. Eye drops at birth are given for the main purpose of helping to prevent any possible infection in your baby's eyes from their trip down that wonderful birth canal during labor. Eye infections can lead to blindness in children and are often due to the same bacteria that causes gonorrhea or chlamydia in women. The second one is PKU, or the heel prick test. Phenylketonuria and hypothyroidism is checked for in all newborn babies across Canada. PKU is a disorder whereby the body is unable to digest phenylalanine, a protein that is essential for growth and development. Too much of this protein in the body is toxic to the developing brain. Blood is collected through the small heel prick. It is done as close to discharge time from the hospital, but no later than 7 days after birth. Therefore, if your doctor did not do it while you're at the hospital, they will inform you of this, and you will have to make an appointment with your doctor or the child's doctor to have this test done. Vitamin K injections. Newborns get a vitamin K shot usually within the first hour after birth in order to prevent or slow a rare problem of bleeding into the brain weeks after birth. Vitamin K promotes blood clotting. The fetus has low levels of vitamin K as well as other factors needed for clotting.
The next things we're going to be looking at are just some things that you're going to notice when you first bring baby home. So vitamin D drops. So these are going to be recommended by your doctor for if you're bringing your infant home and you're breastfeeding. So most formulas have vitamin D in them, but your breast milk doesn't automatically. So until your baby can produce vitamin D in their normal diet, they will ask you to use vitamin D drops to help them get that. The next thing we're going to go over is umbilical cords. So your baby's going to have a little umbilical cord attached when they come home. This cord stump turns dark and black within a couple of days and falls off within 7 to 14 days. There may be some spotting, blood around the stump as the cord loosens and falls off. It's important to keep the cord clean and dry until it falls off. There's no difference between using tap water or rubbing alcohol and time it takes for the cord to fall off, or infection rate. It is suggested that you follow the routine suggested by your hospital staff. So this is important before you start doing anything like tummy time. So remember to just keep it clean and sanitize, and don't put the diaper over it.
Next slide, birthmarks or stork bites. Stork bites are red areas on the skin that are formed by a collection of tiny blood vessels. These marks will fade and eventually disappear completely without treatment. Mongolian spots. These are areas of pigment. May look like a bruise. They usually appear in the lower back buttocks area. Commonly seen in darker skinned babies, Aboriginal, Asian, African, or South European babies. Mongolian spots generally disappear on their own by the age of 4 or 5.
Lanugo. So Lanugo is a light layer of downy hair across an infant's back or shoulders. It's more common in preterm infants, but usually your baby might come with Lanugo anyway. This usually falls off over time, and it's very light layered hair, and it's nothing to worry about. Next we're going to talk about swollen breasts. So this can count for boys or girls, and as well as genitalia. So both boys and girls may have swollen breasts in the first few days. It can be caused by the excess of maternal hormone. So this can be estrogen usually. So this just causes a little bit of swollenness over a few days, but it will go away on its own.
Our next slide is Vernix. Vernix is a whitish, waxy substance that protects babies' delicate skin while in the womb. Post-term babies have started to absorb this Vernix into their skin and are more prone to having dry skin after birth. There is no need to wash the Vernix off. It will be absorbed into the skin. It is almost like a natural lotion to keep the skin soft. And if you try to rub it off, you may see some discoloration, you may cause bleeding. So it is best to leave it on and let the skin absorb it itself. Jaundice. Jaundice generally appears within 48 hours after birth. Jaundice is a yellowish tint to the skin and the whites of the eyes that are caused by high levels of bilirubin. It's a breakdown of red blood cells in the blood, which is normally excreted in the baby's bowel movements. About 50% of newborns will develop mild jaundice. If breastfeeding, frequent nursing is the best way to prevent or help the baby get rid of the excess bilirubin in the first few weeks. Notify a healthcare provider if baby is jaundiced. Not feeling well, there's a decrease in the number of wet diapers, less than 8 per day, and the baby is lethargic or is laying limp and lifeless. With this, there are treatments that they can do. Photolight, if it gets too severe, they will be placed in an incubator with photolights on them to help decrease the jaundice.
All right, now let's look at baby's head. So first we're going to look at molding. Molding is caused by the skull bones overlapping to conform to the birth canal. However, the head will return to its normal shape within a few days. So as you can imagine, if your baby's head was the same shape it was after birth when coming down the canal, it would not be a very fun process. The head of the baby may appear elongated and may be cone-shaped. Cephalohematoma usually appears around 24 hours after birth and is a result of buildup of blood caused by trauma during the birth process. This may take months to resolve, so be gentle in washing the area. Next is fontanelles, another thing around the head. So the fontanelles are the two soft spots on the baby's head where bones have not fused yet. The spot in front will usually close by over 18 months, and the spot in the back will usually close by 2 months of age. Fontanelles may be visible in babies with little or no hair and may pulse with the baby's heartbeat. Normal handling of the baby will not hurt the baby, but if the fontanelles seem shrunken or an indent develops when the baby lies flat and is not passing much urine, he or she may be dehydrated. You should increase the baby's feedings and see your healthcare provider.
Next, we have eye color, tear ducts, and cross-eyed or transient strabismus. Eye color. Most fair-skinned babies' eyes appear to be dark blue in color in the first month, while darker-skinned babies tend to have more brownish black eyes. The natural color of the baby's eyes will gradually appear over the first months after birth. They may not stay the same at birth. They may change somewhat. It could take up to a year to 2 years before you know exactly what the color of your baby's eyes are going to be. Tear ducts. Puffiness and red streaks are normal after birth, often due to the pressure on the baby's head during birth. Babies don't normally shed tears when they cry for about the first 3 weeks after they're born. Tears may leak as their ducts develop, even when they're not crying. Newborns may have discharge in their eyes due to the lack of tears. Always gently wipe the eye from the inner corner by the nose to the outer corner by the cheek with a clean cloth or cotton ball, using a new surface area every time you go to clean or to clean the other eye. Cross-eyed, transient strabismus. Babies usually appear to be squinting or may have a wandering eye in the first few weeks after birth. The eye will usually correct itself over time as the baby's muscles strengthens and learns how to control their eye movement.
For this slide, we're going to be taking a look at skin rashes. So your child may, in their time as a baby, get skin rashes. As newborns, this might look like small mosquito bites. But for this, we're going to be looking more into some of the other skin rashes you might see. So the first one we're going to go over, because this is very common, is cradle cap. Cradle cap is a yellowish or brownish, greasy scale found on the scalp in the first few months after birth. These scales may spread down to the brows and even behind the ears, but they are harmless and should not be removed by picking. I repeat, do not pick. Reduce regular use of shampoo and rinse scalp well during bathing to reduce the amount of cradle cap you're going to be seeing. Gently brush with a comb or use a washcloth to remove loosened crust, but please don't pick at your baby's scalp. Next, we're going to talk about baby acne. Babies' pores are not yet working efficiently, so baby acne usually affects babies 3 to 4 weeks after birth. Sometimes, however, babies even exhibit signs of baby acne right from time they are born. As parents, when we see baby acne, you want to do what you do your acne and you want to get rid of it. For baby acne, it is harmless and it does not really require any treatment. So they generally disappear on their own in a few weeks. So once again, please do not pick or pop because this can cause scarring on the baby's face. Moving on now, we're going to talk about milia, which is another one I'm going to tell you not to pick or pop. So So amelia are tiny white spots that may be on your baby's nose, chin, or cheeks. They are caused by blocked sweat and oil glands, and they are harmless and will clear up on their own. So please, again, if you're noticing any of these things on your child's head, please try and refrain from picking, because this can lead to scarring that will be long-term.
Next, mouth, sucking or nursing blisters. Strong sucking causes blisters on baby's lips. These cause no discomfort to the baby and will gradually disappear as the lips toughen. You can use a clean cloth to remove dead skin off the lips. Do not pick it off. Clean cloth, damp, to wipe the lips off. And now the last two, feet and hands. Acrostenosis is when the baby's hands and feet may appear slightly bluish in the first few days after birth, as their circulatory system is still immature. The baby's hands and feet will pink up when the baby's held or when baby cries. The bluishness will lessen as the baby matures and the circulatory system becomes more efficient.
Your baby may already be born with long nails, so keep baby's nails trimmed with baby nail clippers or little baby scissors. Mittens are not recommended as babies use their hands and fingers for comfort and soothing.